This lecture is on articulations or joints. So far, we've defined joints as a place where two or more bones connect. And we've also said that joints can be classified in two ways. One is by their function, that is, how much movement they allow. The second way is by their structure, and that's determined by the tissues connecting the two bones and also by the presence or absence of a joint capsule. So we had finished up talking about the structural categories, and we said that there were three structural categories, that is fibrous joints, cartilaginous joints, and synovial joints. So now we're going to continue on by talking about synovial joints. Synovial joints exist when the connecting bones are surrounded by a fluid-filled capsule. These are the most common type of structural categories. So in other words, most joints fit into the synovial joint category for structure. Now, since synovial joints are so common, we're going to talk a little bit about their structure in more detail. You can see from the photo here on the left that we've got two bones and they have a capsule around them. All synovial joints have the same 6 components in their capsule. The first thing is a joint cavity. And you can see in the middle here, this area is the joint cavity. Now, if you look at the two bones that connect, you will see this blue tissue, which is lining where the bones connect, and that is articular cartilage. Remember that articular cartilage is actually hyaline cartilage, and it's covering and protecting the surface of the bones. The next thing that you'll notice is the joint capsule is completed by this green area, which is actually synovial membranes. So the joint capsule is lined with articular cartilage where the bones connect, and then the synovial membrane on the other side. Now, these synovial membranes actually produce synovial fluid, which is the fourth component. This synovial fluid, actually, a lot of it is coming from the blood, which surrounds the synovial membrane. And components of the blood will flow through the synovial membrane into the joint cavity. In addition, the synovial membranes will contribute their own ingredients to make up the synovial fluid. Now, synovial fluid has the consistency of egg whites. So it's very gooey, a little bit viscous. However, when the joints are in motion, such as during exercise, the fluid heats up and becomes thinner and less viscous and becomes a very good lubricant. So one of the roles of synovial fluid is to reduce friction between the surfaces that are rubbing up against each other during movement. You'll notice that on the outside of the synovial membrane, you have a fibrous capsule, or it's called an articular capsule. And this capsule is actually made of dense, irregular connective tissue. Now remember, dense, irregular connective tissue has a lot of collagen in its matrix. The collagen is traveling in all different directions, so it's able to resist stress in different directions, which is why it's a perfect component of the fibrous capsule. And lastly, you have ligaments. And you can see here that the ligaments are actually the outermost part of the capsule. So these are components. Now, most of our joints, of course, are synovial joints, and we want to prolong the life of our joints as long as possible. as the population in the U.S. ages, as the baby boomer population, more and more of them move towards retirement and their elderly years, more and more people are having impacts on their joints. So remember that even though joints have the articular cartilage that's protecting the surface of the bone, the synovial fluid, which is a perfect lubricant, still over time there is normal wear and tear in the bones. And some people end up with osteoarthritis. In fact, 85% of Americans have or will have osteoarthritis. So how do we prolong the life of our joints? Well, exercise. Why does exercise help? Well, one reason is it prolongs the life of the cartilage. Remember that cartilage is avascular. It doesn't have any blood vessels. However, the chondrocytes and the lacuna need to stay alive, which means they need oxygen and nutrients. Well, the oxygen and nutrients is in the synovial fluid. So how do you get that into the cartilage? In addition, the chondrocytes produce waste and carbon dioxide that they need to get rid of. Well, what happens is when people exercise, they put pressure on the articular cartilage, which squeezes out the waste. And then when pressure is taken off the joint, the cartilage acts as a sponge and sucks in the oxygen and nutrients. So by exercising, you prolong the life of the cartilage by moving oxygen and nutrients into the cartilage. And of course, the reverse is true by moving waste and CO2 out. In addition, when people exercise, the synovial fluid heats up, which makes it a better lubricant. So again, exercise heats up the synovial fluid, which makes it a better lubricant. And lastly, exercise strengthens the joint by building up the muscles that support the joint and by increasing the density of the bone. So all of these things reinforce the joint. So again, exercise strengthens the joint by building up the muscles that support the joint and also by increasing the density of the bone because you're doing weight-bearing exercises. Okay, so that's the synovial joint. Now, there are structures found around the synovial joint that also help to strengthen it. And I'd like to mention two, bursa and tendon sheath. So bursa are actually fibrous sacs with synovial membranes. And you tend to find them where structures rub together or around a synovial joint. Now in the picture below, you can see the humerus, the upper arm bone, and a little bit of the scapula. We can see the acromion of the scapula here and the other part of the scapula here. And you'll notice there's a synovial joint around, a synovial capsule around this joint. So here, you can see right here is the fibrous layer, the fibrous capsule. And then you can see a little bit of the synovial membrane here in green. You can see the articular cartilage in blue that covers the surface of the bone. And you can also see again, here's the fibrous layer of the capsule, and you have some ligaments also. So here's a bursa right here. It's called the subacromial bursa because it's below the acromion. And you can see it is a sac of synovial membrane with synovial fluid in it. So what the bursa does, if we look over to the picture on the right here, is it situates itself between two things that are going to rub against each other as this joint moves. So as this bone, the humerus, moves forward, the surface of the articular cartilage is going to rub up against this particular ligament. And what the bursa does is it rolls between the two, back and forth. So as the joint moves, the bursa moves also between them. Almost like a ball bearing in an engine, if you know what that is. It's kind of an interface between the two surfaces so that they don't rub up against each other. Oops, go back here. Another structure you can see in this picture is actually called a tendon sheath. And a tendon sheath is an elongated bursa that wraps around a tendon, kind of like a hot dog roll wraps around a hot dog. And in this figure here on the left, you can see the tendon, which is attached to a muscle called the biceps brachii. And this tendon actually runs right through the synovial joint, and around it is a sheath of synovial membrane. So again, that's protecting the tendon so that when the joints move, the bones move, the tendon doesn't get worn down. So when we look at these synovial joints, they have a lot of flexibility. Remember, they are diarthrotic, freely moving joints, and as a result, they are the least stable types of joints. So what factors help stabilize the joint? Well, the first one is the shape of the connecting bones. So you can probably think of a lot of bones, but probably the easiest one would be the femur and the coxal bone, so the upper leg bone and the hip bone. And in the hip bone, there is an opening like this called the acetabulum, and that is where the head of the femur kind of sits. Here's the femur. So maybe 3/4 of the head of the femur fits in that socket, and that helps that joint to stabilize. So it's hard for the head to fall out, for the femur to fall out. But this doesn't always help. So for example, if we look at the humerus and the scapula, there's also a cavity in the scapula called the glenoid cavity. And it's fairly shallow. So if you look at the humerus, only maybe 1/4 of the head of the humerus fits into that cavity. So it doesn't really stabilize the joint that much. In fact, the shape of the connecting bones rarely is helpful in stabilizing the joints. Another thing that does help stabilize the joints is the number of ligaments. And generally, the rule of thumb is that the more ligaments, the better. In other words, the more ligaments, the more stable the joint. However, ligaments can only extend a certain percent, maybe 6% of their total length before they snap. So this is not always that helpful either in stabilizing the joints. The last thing that helps stabilize a joint is muscle tone. And in fact, muscle tone is the most important thing when it comes to stabilizing the joint. So how to describe muscle tone since we really haven't started the muscle chapters? Well, one way to think about this is that your muscles are in a constant state of partial constriction. This means that they are always partially contracted. And this is caused by the nervous system. So your muscles are always partially contracted. The nervous system is always sending nerve impulses or action potentials to the muscles to cause them to partially contract. Now, this doesn't always result in movement. So as you sit here listening to this lecture, the nervous system is sending nerve impulses to all the muscles in your body in a systematic way. And the purpose of that is to keep the muscles in shape and alive. So one way to think about this without having a little bit more background is that your muscles or components of your muscles are always having little mini workouts, even when you actually are not physically moving. And this is important because without that constant stimulation, muscle fibers would begin to deteriorate and die. So when it comes to stabilizing your joints, muscle tone is the most important factor, and it is largely a role of your nervous system, although you can certainly improve it by specific types of exercise. So what I'm going to mention next is some important synovial joints, and by that I mean major synovial joints. And these include your ankle, knee, hip, shoulder, elbow, and wrist. I'm just going to highlight one of those, which is your shoulder joint, also known as the glenohumeral joint. Now, this is the most freely moving joint in your body, and as a result, it is the least stable. It is found between the scapula and the humerus, as you can see in the picture here. And a couple of things here is you'll notice in this picture that there are many ligaments. Now, this is an anterior view. You'll see an anterior view. And so we've got the humerus. You can just barely see it here. And then you've got the scapula over here. So you can see a large number of ligaments. And the ligaments can be named by the processes to which they're attached. So, for example, this ligament right here is called the coracohumeral ligament. And that's because it is attached to the coracoid process of the scapula on one end and the acromion of the scapula on the other end. Here's another one, the coracohumeral ligament. It is attached to the coracoid process on one end and the greater tubercle of the humerus on the other end. So this is one of the reasons it's very important to learn the bone markings, because this is where ligaments, tendons, and muscles attach. You can also see some bursa scattered throughout here between processes or structures that are going to rub up against each other. You can see the tendon sheath also. So what stabilizes these joints? Well, one thing are muscles and their tendons. Now remember, tendons connect muscle to bone and are often constructed of dense, regular connective tissue. So this is a lateral view of the shoulder, and they've removed muscles and other things, and you can see the glenoid cavity here in the center. And what you're looking at here are actually tendons which make up something called the rotator cuff. So the rotator cuff actually consists of muscles and their tendons. And the rotator cuff is really what stabilizes the glenohumeral joint. Now, the four muscles that make up the rotator cuff are the supraspinatus, the infraspinatus, the subscapularis, and the teres minor. So what happens is when the muscles have good tone, they're contracted, partially contracted, and that contraction pulls on the tendons. And you notice the tendons are arranged around the joint in a circular fashion, rotator. That's where rotator cuff comes. So if the muscles are in good shape, the tendons pull tightly around the joint and they hold the humerus to the scapula. So again, the muscles and their tendons, but it's really the muscle and the tone of the muscle that helps mainly. What weakens the joint? Well, a couple of things. Remember, we said that glenoid cavity is very shallow. So it's easy for the humerus, or not, it's easier for the humerus to pop out. Another thing is that there did appear to be a lot of ligaments in one of the pictures that we looked at, but most of these stabilizing ligaments are anterior. And there's not a whole lot posteriorly. And so that's a weakness. And lastly, the joint capsule, which is made of the fibrous tissue, the dense irregular, is very thin. So it doesn't help stabilize as well. So these are the things that weaken the joint. We talked about muscle tone being the most important thing that stabilizes the joint. What are some injuries that you can see through for the glenohumeral joint? Well, there's shoulder dislocation and shoulder separation. Shoulder dislocation is when the humerus pops out of the glenoid cavity. And it usually occurs from repetitive forward and downward movement of the arm. So this kind of movement is very common in pitchers in baseball. And what happens is the tendons stretch or they can tear, and so that joint is weakened. Shoulder separation, on the other hand, is when the junction of the clavicle and the scapular is disrupted. This usually occurs from some kind of blunt trauma, someone getting hit in that area, this is often happens in football or hockey, or even someone just falling down with their hands kind of stretched out in front of them.